This might be an unpopular opinion, but I think sometimes CBT or cognitive behavioral therapy can be a bit of an insult. So I want to say from the outset, CBT is not a problem. I'm not saying CBT is a bad thing. Cognitive behavioral therapy has helped so many people. It's really helped them to manage their problems, their conditions, and also just their general behaviors, depending what kind of ailment or sickness that they have. And CBT isn't always going to be about dealing with symptoms or pain. It's also going to be about helping people with mental health problems, whether it's depression, whether it's loss, whether it's people who have PTSD, whether it's people who have anxiety, or just dealing with the mental daily stresses which people are having difficulty managing on their own. However, in this context, when I say that CBT can be insulting, I'm not talking about it in the context of a mental health professional when they are doing the work. They're doing great work. It's more in the context of maybe another practitioner, whether it's a doctor or somebody else, who says that somebody may need CBT based on the fact that they can't figure out what's happening with their symptoms. And this is a pattern I've seen happening more and more over the years, with some people who have quite complex cases who may, of course, have their own stresses, their own mental health issues going on to some extent, but they're told that basically everything that's happening with them, whether it's headaches, severe dizziness, something like that, that it's kind of purely in their head, so maybe CBT is what's going to help them, without addressing that there is something also physically happening with them. However, this is just my experience. I was kind of curious and I did a bit of research online. And that's where I came across this study where it talks about patients' responses to the term pain catastrophizing. So essentially looking at patients who are told that, their pain is not as bad as they think it is, and that maybe they can deal with it in a more mental health approach rather than dealing with a more physical, organic approach. And we can see that here when we're looking at the abstract. Literally the very first sentence where it talks about the concept of pain catastrophizing is understood as a negative cognitive and emotional response to pain. But for many people with chronic problems, which are complex cases, it's not necessarily that they have a mental health issue which caused the symptoms and the pain. It's kind of sometimes the other way around. They've been dealing with problems for months or for years, so it's completely understandable then it starts to have an impact on their mood, which then makes it look like it may be just their mood which is causing one, but it can be a mix of both things happening at exactly the same time. And when looking into the results of this study, this is where we could see that 1/3 of people rated the term as being problematic. So that's being a catastrophizing term where they think it's more mental rather than something truly organic or physical, with 12% reporting it as being applied to them and creating a negative experience. So there are some cases where somebody may have something which is more psychosomatic, which means that it is something more mental health, which is affecting and creating some of the symptoms that are going on with them. But I'll be honest, I think it's probably a much smaller proportion of cases than people are led to believe. And this is not just based on myself, that's something we can see again in the research. Before suggesting CBT, really they need to see a mental health professional so they can assess them to determine if CBT would even be effective for them in the first place. So if you've been told that CBT or another mental health intervention is going to be what